1 year since 23-year-old Iryna Zarutska was stabbed to death while riding a light rail in Charlotte's South End neighborhood. And since then, major laws have been changed. Take a look.
1 year ago, Iryna Zarutska's death forced North Carolina to take a hard look at the intersection of mental health and public safety. Today, there are new laws. But the people helping families navigate the mental health system say there's still a familiar problem.
But they still face issues.
Getting people help and getting it fast.
There's a lot to do, a lot of work to do.
Megan Talbot is with NAMI Charlotte. She says the number of places available for someone who needs inpatient psychiatric care has not changed.
The number of psychiatric beds available in the state have not changed since Iryna's law. And that is the fundamental issue that has not been addressed.
The state's own numbers show the pressure. North Carolina has roughly 2,500 inpatient psychiatric beds for a state of more than 11 million people. North Carolina Department of Health and Human Services says only about 80% of those are operational because there aren't enough healthcare workers to staff them.
That's not a lot of beds.
Dr. Carrie Brown is with North Carolina DHHS. She says one of the biggest changes coming is a new involuntary outpatient commitment standard. It's designed for a small group of people with serious mental illness who have a criminal background and are not following treatment.
Requires those individuals to take medication and work with a mental health provider, essentially in order to stay in the community.
Brown says that doesn't take effect until December. Another provision of Iryna's law requiring evaluation for involuntary commitment under certain circumstances doesn't take effect until December of 2028. So 1 year after the tragedy, the state says it's still too early to measure the impact of some of the biggest changes made in response to it.
We need to have sustained investment in the public behavioral care system in North Carolina. It can't just be one-time funds.
The services have to continue.
Talbot says the need goes beyond the crisis response.
North Carolina needs to invest in the full continuum of care. And we're going to end up paying for it in other areas of the community if we don't pay for the mental health care.
1 year after Iryna's death, North Carolina has changed its laws, built new tools, and by the end of this year, some of those new tools will finally begin to be tested. But for families trying to get someone help today,
fundamentally, the experiences from our families, their experiences have not changed since Iryna's law.
Tradisha Woodard, WCNC Charlotte.